Hi everyone, thank you so much for coming. My name's Georgina, I'm the chair of the SRA North, so this is sort of my on the side sort of volunteer position where we like to put events on to kind of share knowledge and champion sort of research that goes on around the North, put events on in the North so that they're easily accessible for people who don't live in London or live elsewhere. And today we've got a really great event all about behavioural science in social research. So behavioural science is not necessarily a new discipline, but I think it's got loads of applications in social research that are being continually sort of developed, and that's what we're going to look at today. We've got 4 speakers from sort of different areas of social research, sort of government, agency, NHS, and that's going to really give us kind of a different perspective on all of the ways that you could use behavioural science, hopefully show some applied examples as well, what works, what doesn't work, and how you might be able to use this in your own research practice. So it's going to work like we've got 4 speakers, one after the other. Then we've got a Q&A. So save up your questions, but please do have questions. We want to have a nice discussion at the end. And then we have a bit of time left over to network and just chat to either the speakers or between each other. Since we're here, it's a great opportunity to get to know other researchers. So that's all that is really from me. Obviously, teas and coffees over there, water if you need it, please just get up and get it. Or cake, if you have a particular burning urge for cake, please go up and get it. And that's about it. If there's a fire alarm, I'm assuming we just leave out the door, which is right there. That's all of the kind of housekeeping that I have. So we have our first speaker, which I'm really pleased to welcome Bev Bishop from the Department for Transport onto the stage.
Right, thank you very much for inviting me. It's really nice to be here. I always love the SRA events, so many researchers from lots of different backgrounds. So today I'd like to do, next slide please, I'd like to do a very brief history, very brief canter through behavioural science in UK government. And then I was going to say a few words about my experience using behavioural science in the Health and Safety Executive, in the formative evaluation of the NHS COVID-19 app. Remember that, the pandemic and all that, and in the Department for Transport. Right, so where it all started. Well, where it all started in government, really. Obviously, in the commercial world, they've known about behavioural insights for nudges for a very long time. Bog offers, buy one get one free. Putting the fruit at the start of the supermarket so you feel healthy and you can buy the biscuits as you get further along. All those kind of nudges that we're not even aware of that influence our behaviours. But then a book by Richard Taylor and Cass Sunstein in 2008 had a very significant impact on UK government policy because it introduced the concept of nudging, subtly influencing people's behaviour to achieve better outcomes for themselves and for society as a whole. So not just for commercial purposes, but in the practical applications of public policy. A couple of years later, Thinking Fast and Slow was published by Danny Kahneman, which talked about the science behind that. Essentially 2 main concepts, the idea that we have dual processes of thinking, system 1 thinking, which we use most of the time. We mainly act automatically. If you drove here, you probably don't remember changing gear. The amount of times I go back because I think, have I locked up? Have I left the gas on? I've always locked up and I've always turned the gas off, but it's been done automatically. And that's how we act most of the time, sort of automatically, systematically. System 2 we use when we're doing an exam, when we're thinking, when we're writing a talk, that kind of thing. But most of the time we rely on system 1, and sometimes we make errors because we rely on shortcuts. And Nudge basically said how government can use these errors, these shortcuts, to make people default into doing the right thing. So it's got obvious attractions. It's a relatively low-cost policy option compared to taxation and regulation. It's not perceived as burdensome to business or the individual. And perhaps most convincingly, there were several very effective experiments. So in 2010, the Cabinet Office set up the Behavioural Insights team, the Nudge unit, and we've got a representative of the Behavioural Insights team here today, which is brilliant. And they developed Mindspace, which was a mnemonic about using messengers, incentives, social norms, etc., different heuristic biases to encourage people to do things that aligned with the way government wanted policy to go. They had some really notable successes in tax, education, and NHS waiting times. HMRC wrote letters to debtors using social norms. So 9 out of 10 people pay their tax on time. So, and that was more effective than several £1 million worth of inspectors' time going out and looking at the books. There was a 34% increase in acceptances of pupils from underrepresented schools to top universities, following a letter to pupils from a top-tier student with a similar background. So, if you can see it, you can be it, and that made pupils more aware that they might have the opportunity to go to a top-tier university. And there was a 38% reduction in patient referrals to overbooked hospitals, resulting from the installation of a pop-up prompt in the GP referral scheme. Are you sure you want to refer them to X hospital? Because of the Alexandra, they've got shorter waiting lists. So that just made doctors more aware. After the popularity of Mindspace and its use across government, in 2012, East was published, which even more accessible tool, which said that for a nudge to work, it should be easy, attractive, social, and timely. In 2014, BIT was spun out of government as a social purpose company, but it still has customers in government, but also in the private sector, overseas governments. But in the meantime, 24 UK government entities have set up their own behavioural science team, and many other government social research and communications teams are using behavioural science. These are still on gov.uk. Have a look at them if you are new to behavioural science. Really accessible and really, really helpful. Right, so around 2010, 2011, when BIT was set up, there were various conferences to sort of launch it to government social researchers. And myself and my colleague Clark travelled down from Bootle, where we worked at the Health and Safety Executive, to a conference in London, where we were introduced to nudging, and we got so excited that we got thrown out of the quiet coach on the way back. We were thinking, well, how could we use this in health and safety? How could we? Because what we've typically done is tell people, well, this is the safe thing to do. Why don't you do that? We always when we have an accident, we think that's so stupid. I knew that I shouldn't have done that. There was a big problem with wobbly chairs, teachers falling off wobbly chairs when they were putting their kids' work up on the walls. Now, you're not supposed to stand on a wobbly chair, and teachers aren't stupid, but, perhaps the janitor was a bit grumpy and it was over the other side of the room, the other side of the school, and you had to sign out to get the ladder, that kind of thing. So we thought about ways that we could use Mindspace and other nudges to try and make health and safety easier for people. Right, so what we did is we put together this tool which we called Inspect. We were quite proud of that, about how you can use incentives, norms, salience, priming, emotion, choice structure, and trusted messengers to influence people to adopt healthier and safer workplace behaviours. And the way HSE works, we often work through bodies of employers and perhaps an NHS body and a union working to solve a particular issue. So we went to the Welding Fumes Forum, and we went to the Forestry Forum and the Noise and Vibration Forum and the Food and Drink Federation, and we hawked this tool around, and we said, so what are the persistent problems of health and safety in your area that you're looking to solve, and can we go through this checklist and think about ways that we can help? And the union guys and girls who don't often work sort of closer would often have really brilliant ideas. They were going, well, the problem with dust in this organisation, and we know we're supposed to use water to keep it down, but we don't. Why don't we have black surfaces so the dust is more visible? You go, oh, that's brilliant. And there was another fella that said, ladders. I've always wondered why they don't have spirit levels on, so you can get them to the right kind of the right angle when you've got them up. So people, a lot of this is intuitive, and people do have brilliant ideas. So we collected examples of this, and we also promoted it internally and to external bodies to try and get them to use it. Sorry, can you go back to the previous one? So this one here, this is the Shattered Lives campaign, which made slips, trips and falls more salient. This predated us, but I think it's a good example of making things more salient. Trusted messengers, that's Ian Wright, who was, I think, a joiner, but he had credibility with joiners. People knew he was a joiner, and he fronted our asbestos campaign as a trusted messenger, because people trust people who are people like them or legitimate experts. Yeah, use both. Priming, that encouraged people to adopt good housekeeping and put the tools of their trade back on this shadow board so that people didn't trip over them. And this one I loved. This is Make the Promise, Come Home Safe, which drew on emotion and salience. And we tried to encourage farmers to make the promise to their families that they would come home safe. And we gave out these little safety knots. They were called green safety knots that you could put on your keys, on your tractor keys, so you remembered to turn the tractor off when you got out, or on the gate to remember to close the gate so the cow didn't walk into you, or whatever. But they love these, and people would ring up and go, "Can I have some more of these safety knots?" We went to a Safety and Health Awareness Day, but I thought I might put one there and one there. So that was Inspect. That was the sort of start with nudging. As behavioural science got more sophisticated, who's familiar with COM-B, or the behaviour change wheel? Yeah, I think most of you will be. Susan Mickey put it together, and the COM-B model, a really helpful way of mapping the barriers and facilitators of people of good and not optimum behaviour. So Susan Mickey argues that in order for people's behaviour to change, they need to have the capability, opportunity and motivation to make that change, the physical or psychological capability to engage in a particular behaviour. The external environment has to support it, so that might be social norms. If none of your friends use public transport, then it might not occur to you to use public transport. You need to be motivated. There might be a conscious or unconscious, consciously or unconsciously, and that will. And if one of those changes, that might impact on your likelihood of adopting or not adopting that behaviour. So after I worked in HSE for a few years, the Inspect kind of faded into the distance a bit. I was working on sort of post-implementation reviews, that kind of thing. And then the pandemic happened, and I was in the right place at the right time and was asked if I would work for 6 weeks to evaluate the NHS COVID-19 pilots. Initially, they were going to be evaluated through anonymous app usage information and online surveys, but the team of which I became a part said, no, we really need to do some qualitative research. We need to find out why people do and don't adopt these. We also had multilingual telephone surveys in Newham, and we did in-depth qualitative interviews with app users and non-users, and applicable venue managers in all of the 3 early adopter pilot groups. We came up with a number of barriers and facilitators around capability, opportunity and motivation. So I'll just choose one from each for purposes of time, but language barriers, for example. A lot of people perceived that the app wouldn't be available in the language that they spoke, although it was available, but we hadn't publicised that well. Opportunity. People had concerns about if they would be able to self-isolate. I don't want this thing on my phone because I need to go out and earn a living, and I can't self-isolate. And if it tells me I've got to self-isolate, I just can't do it. There were social concerns. They felt that if others weren't doing it, it was pointless. And there was concerns about people's privacy. That was a big concern that stopped people adopting it. Motivation. We spoke to people and said, well, what would you like on the app? What would make you download it? And people wanted to understand if they'd been at risk. They wanted access to useful information. And a lot of people who adopted it, were early adopters in the pilots, were motivated by a sense of civic or public or social responsibility to help society and protect their loved ones. So in the behavioural insights that were included in the app rollout were that data privacy concerns were addressed in a public-facing video, first and foremost. GP involvement was key in promoting the app to individuals, and local authorities were a crucial intermediary with business, so those were the trusted messengers that worked. We published the download numbers and they were good. So lots of people are doing it, so it's not pointless you adopting it. And people could claim benefits through the app during self-isolation. We also made the multilingual elements more salient. When it was rolled out, the download numbers went from between 9 and 15% in the pilot areas to over 56% of eligible users. So there was a big step up. I'm not saying it was all down to these nudges, but there was a very significant uptick in the number of people downloading it. And for every 1% increase in app usage, there was a decrease in COVID of between 0.8 and 2.3%. And it was estimated that the app stopped 600,000 cases of COVID and saved 8,700 lives. Right, so that's just I will say we didn't do Combi systematically. It was all crazy at the time. It was like, somebody in this focus group said that, oh, I don't know, maybe we could get doctors involved, that kind of thing. So so it wasn't like a systematic going through of best practice, but I think it was helpful. Right, so then I went back to my old job at HSE, but I really missed the behavioural science thing. And then this job came up at DFT, which is my absolute dream job as head of behavioural science. Could go back and what we do in DFT is a little bit wider than just nudging and just Combi. We look at how people behave. We look at why they behave the way they do, what would change that behaviour, and how we would evaluate that. So, for example, if we're looking at how people behave, a case might be the use of private e-scooters. I don't know if you've seen those on the streets. They're not supposed to be on the streets. You're only supposed to use the pilots. But the research sought to develop an understanding around the current usage of privately owned e-scooters, the type of people who use them, their reasons for doing so, their role in modal shift, drivers and barriers of unsafe behaviour around private e-scooters, and awareness and perceptions of legislation, and opinions on what future regulation, should we legalise it, might look like. We look at why people behave the way they do. So, for example, my team currently is looking at what the barriers and enablers of travelling by rail. So we're looking at users, non-users, lapsed users, also by different demographic groups, and understanding that can help us improve our predictive modelling when we're building new rail infrastructure, and also inform strategies to increase rail usage. So we might do things like barrier and driver mapping, systematic reviews, persona analysis. DFT's got these, not everybody reacts in the same way to different stimuluses. So we have 12 personas, Nigel and Nigel and Gina and all these different people who might have children, who might be caring for an elderly parent, and they're going to react to policies in a different way. So we'll do some persona analysis. What would bring about change? Next slide, please. As I said earlier, a lot of our behaviour is just driven by habits. When there's a moment of change in our lives, for example, like residential workplace relocation or starting a new job, that may not only break the habits, but it might also change our capability, opportunity, and motivation to adapt our behaviour. So interventions can be particularly effective at moments of change, and we've just been doing a big study on that. We don't just do research, we do a bit of consultancy, intervention design workshop, co-creation sessions, and interventions pre-testing. And we recently kind of got into resilience, so we can try and predict, say, what would happen if there was a flood, evacuation due to flooding. What does behaviour theory say that people will do? And finally, did the change work? Well, we can make predictions about what will bring about behaviour change, but it's important to rigorously test our assumptions. So the team can run rapid online tests to evaluate how we expect people might behave. Our previous minister wanted us to identify the best options for representing EV charging points and the best colour format. Spoiler alert: it's green is better and the car is better. But that's we know that people are worried about running out of charge is a key disincentive to purchase. So that can have an impact, and that can have an impact on net zero. We might do field experiments, sort of pairing with a real life website to test it in the real world, and evaluation to look at whether our interventions worked finally. So that's a brief canter through, but yes, I'm very happy to sort of follow up afterwards. Do you want to cut into anybody else's time? Thank you very much.
My name is Govindeep Sidhu. I'm a trainee health psychologist based at Hull University Teaching Hospitals. I was also completing a secondment with the behavioural science team at the Department of Health and Social Care. And today I will be talking about a research project I did as part of my stage 2 training in becoming a health psychologist. And in that research project, I was exploring the barriers and facilitators to the ICU staff using a debriefing tool. So in this presentation, this is what I'll be covering. So I'll explain why I did this study, methodology that I used, how I've used COM-B and TDF, and the findings from my research project, along with my reflections and future directions of the research. So why did I choose this study? So as you can imagine, ICU staff face a lot of very distressing situations, treating people who are perhaps the sickest patients in the hospital. And due to that, they face a lot of trauma, whether it's vicariously just by witnessing the trauma that people have actually gone through to get them into ICU, or from providing treatment and care to a patient that perhaps the treatment is futile, it's not really going to make too much of a difference. There's a lot of moral injury that happens for ICU staff. And as you can imagine, going through all that distress can lead to harm to their own well-being. So it's quite common that ICU staff experience high levels of burnout, decreased job satisfaction, and this can then affect their own performance, their well-being, which has a knock-on effect of impacting the outcomes for the patients that they're supporting. So it's quite an important area of research to understand how we can support hospital staff, in particular ICU staff, in managing their own well-being against all the distress and the trauma that they encounter as kind of the normal day-to-day process of their work. And a lot of clinical psychology research has gone into this to develop tools and strategies, and one of those are debriefing strategies. So one of those examples is the Team Immediate Meet tool. So this is a tool that was created by the Intensive Care Society and clinical psychologists with the intention of creating a tool that could help ICU staff cope with the stresses and the distress that they experience in ICU. So what they created was this simple guide here. So this is literally a laminated piece of paper. And what it is a bit of a guide to help structure a conversation around debriefing. And the aim is for this to be a group debrief. It's voluntary, so not everyone has to take part. And it's supposed to be very brief, so up to 2 minutes. And based on the research that's been conducted to test this out, it seems to be very well accepted by ICU staff to find it very helpful and useful in helping manage their distress, and also with having these conversations, which can be a little bit difficult sometimes to start with colleagues when you've gone through something that's very distressful. And as part of this process that I'm in, we've taken on this idea of trying to roll out this tool. However, despite all the good research behind how helpful it could be, it's not being used as much as we'd perhaps like it to be used. So when I heard that, kind of alarm bell started ringing. Actually, great opportunity to start to use behavioural science now, because I think this was a great opportunity to match health psychology with clinical psychology, where the clinical psychologists have created this amazing tool that could be really helpful in supporting well-being. But what it's missing is some of the science around actually implementing it, how to get people to actually start using it. So what I thought was I could do perhaps the first step of deciding an intervention, which is looking at the barriers and facilitators of that, which led me to the research project that I was carrying out. This is the aims of my research project. So it starts off with just generally understanding people's experiences of using the tool. So we've kind of anecdotally heard people aren't using the tool, but are they actually using it? What are the experiences? That was the first aim. Secondly, it was understanding what are the barriers and enablers people using the tool, what's getting in the way, what would make it easier for them to use the tool. And the third one is basically what we're going to do with this insight. This would be really useful at then developing an intervention that could help us roll this out in a more evidence-proven way that actually can lead people using the tool rather than perhaps rolling it out without the evidence behind it. So how we can map perhaps behavior change techniques and what we've identified as barriers. And this is the methodology that I use. So this is what I'll be covering. So I'll go from recruitment, data collection, all the way up to our findings. And so this is the methodology that I use. So the setting was ICU in a large teaching hospital. Participants are aimed for about 15 to 25 participants, which is perhaps the usual amount for qualitative research. And the recruitment method was perhaps a little bit challenging. However, eventually I managed to get some participants. I'll reflect on that later as I go into the slides. However, I've got about 15 members of staff. We tried to get as best as we could of representative of what makes up the population of staff in ICU. So nurses, doctors, consultants, or however, there's also perhaps occupational therapists, surgeons. We didn't really get too many of them. It was largely nurses and a few doctors. I managed to get one consultant, which I'm quite proud of. And in terms of the analysis, we use a split between inductive coding and deductive coding. I'll go into that a little bit later. And the key decision that I made in designing this methodology was not to do perhaps a deductive approach in my interview guide. If you look at perhaps the majority of COM-B research looking at barriers, they'll usually use the COM-B or the TDF to shape the questions, and quite often they'll use this in qualitative research as well. However, I felt doing this research, it'd be better if I didn't do that. So I feel perhaps it lends itself to more bias in the answers that I'm going to get. So what I did was create an interview guide that was very generic, kind of asking people's experiences, what are the barriers, without touching on any of the key aspects of the COM-B or TDF. So I felt like if I was delivering this interview, perhaps I'd spend too much time asking about physical barriers, and it could then influence the findings I'm going to get. So that was a key decision I made in the methodology. And this is the analysis stage. So once I complete the interviews and I gathered the data and I transcribed it, the next step was to do the thematic analysis. So this is where I've split it up into inductive and deductive. The inductive stage was perhaps quite similar to what you've all got experience of when it comes to qualitative research, which is generating themes. So I use the framework method. If you're not familiar with that, I've kind of listed all the stages of doing that there. And initially, that is open coding, identifying barriers to sort of experiences, which is what I was looking for. And once you've done that, you can create an analytical framework and then apply that to the rest of the remaining transcripts, whilst also keeping an open mind to new and emerging codes, which I did find a couple as I went through the transcripts. And by the end of it, what I was left with was a list of themes that really summarize what was coming through for participants who took part in the interviews. And the next step was to then bring in the behavioral science and look at the models. So I've got a demonstration or diagram of the behavior change wheel there, and I assume you're all aware of that if you're aware of COM-B. And so we know the behavior change wheel can be used to design interventions, but also can be used to evaluate intervention and see where perhaps things aren't going as well as possible to get people to do that behavior. And to use that tool, what I did was look at the themes that I've gathered from this qualitative research and then map these to the COM-B and TDF. Initially, I just used the COM-B, but afterwards I realized perhaps it would be more helpful to use the TDF to make it a bit more granular. And this is perhaps what you'd consider to be behavioral diagnosis. So you can see here, the behaviors there, that's what it was. So the tool was a TIM tool, and the behavior we're trying to get is people to actually use the tool. And you can see here, these are the themes that were generated. So I generated 7 themes. And the way I tried to display this was by splitting this up into the colors. So you can see here, each color represents an area of the COM-B, and then it then maps further onto the theoretical domains framework. You can see how the COM-B and the TDF fit together. And I think this is actually quite useful for us getting that one step further from the themes, where perhaps most qualitative research training wouldn't use behavioral science, would stop at the themes. But I think the key advantage of the behavioral science models is to give that structured process when it comes to finding what the barriers are specifically. So looking at the results, these are some of the barriers I identified. And you can see how these are perhaps pulled from the themes that were shown earlier. So the first one was perhaps what most people kind of assumed was a barrier for people that are using the tool, which was just the demands of working in ICU. It's really busy, got really high pressure jobs. There's never enough staff, so we don't have the time to do this. So that was one that perhaps everyone expected to get. However, the bottom one of emotional discomfort was one that I found really interesting out of all the barriers that came up, which was the idea of staff perceived it to be very difficult just to share if they needed some support. They wanted someone to debrief with because they perceived the need to be shown as being resilient to the rest of the team. And if I asked for help, it looks like I'm not resilient, I'm not cut out to work in ICU. So that was really interesting and perhaps something that we didn't expect to get if we asked people who were rolling out the tool. And the second one was benefits of just not using the tool. So we kind of knew people weren't using it too much. And this was perhaps one of the themes that were difficult to code in the COM-B, because initially I thought it's not really a barrier, it's just people's experience of using it, just not using it well enough. But after some more consideration, I realized it actually maps onto the psychological capability and the memory and attention and decision processes of the TDF, because people weren't choosing to use it, didn't feel confident in using it, and because they wasn't using it, it didn't help them build the psychological capabilities to actually use the tool. If we go to some of the facilitators now. So these are some of the facilitators of using the tool. The one that really stood out was the idea for staff wanting someone of seniority really to lead these debriefs. And I had a couple of reasons. One was because they're more senior, they have that leverage and perhaps that respect of the team. So if they start using the tool or initiating it, people will come along to that. Also because they're more experienced. got to be more capable of actually using the tool and leading a debrief. And that's perhaps one of the nuances of the tool, that it was actually designed for anyone to lead it. So perhaps there's some social loafing there where people, no one takes responsibility for leading it, and they identified people of seniority to take that role. And the second one was structured processes. So there were some hints in the transcripts of people wanting to make using the tool more habitual, and they suggested prompts and cues, which lend itself to the behavior change techniques that you'd use if you're trying to build habits and build automatic motivation. So that was quite interesting for me personally. I'm quite interested in habits, so I was glad to see that. But it actually contradicts some of the theoretical understanding of debriefing, that because debriefing should not be mandatory. There's a possibility of harm if you're forcing someone to debrief. So you can see there's a bit of a clash there between some of the perhaps behavioral science messaging or theory behind making the behavior habitual, and some of the theory behind clinical psychology of getting the effectiveness of actually using the tool. Touch on some of my reflections now of using it. So initially, if we talk about that full method and processes, so I touched on recruiting. So initially I thought, if I'm going to recruit, it'd be really nice and easy if I just email all the ICU staff, and whoever's interested will send me an email back, and I'll just pick a time slot and we'll get it nice and done over Teams. It can transcribe all my interviews as well. It'll be super simple. That did not happen. I got like 2 or 3 people email me back, register interest. Even the people who did register interest, they didn't follow up to actually set an interview. So that was a nice wake-up call. So what I had to do was actually attend weekly meetings with the research team that we had embedded in ICU. You have like a bit of a 5-minute elevator pitch to get people interested in my research. Even then, I used to get 10 to 50 people signing up. Never really get them to actually take part in an interview. What was the most effective was just turning up to ICU. Trying to find a time where perhaps it was less busy. I would say quiet, but saying quiet in ICU is banned. You can't say the quiet word. So it was just finding the right opportunity to hang around an ICU and conduct interviews when someone had a spare 20 minutes. And doing that was the most effective way, but it did have some of the cons to it, whereas doing it in ICU meant people were perhaps a little bit distracted, because you can imagine ICU is very busy. There's some beeper going off, there's some noise, there's something happening. So often people were distracted, or there would be literal distractions, there'd be interruptions to the interview, or someone would come in and ask for some help. So it didn't lend itself to the most simple, transparent way of doing an interview, because there's lots of interruptions. When it comes to mapping, so the mapping process was quite iterative. So perhaps when I first started to map the themes to the COM-B and TDF, I put them in certain factors, and after 2 or 3 attempts, then moved around and I mapped it to a different part of the COM-B and TDF. And what's really useful there is to have a second reviewer, like you would when you're doing qualitative research, someone to check your themes and get that agreement. In the same way, you should probably do it if you're mapping themes to the COM-B and TDF, to make sure there's some consensus among how you're mapping to those models. And again, kind of the inductive approach, I think, was really helpful to kind of let people share without bias what was actually getting in the way of actually trying to kind of push COM-B down their throat and push some behavioral frameworks down what they're actually experiencing. So yeah, behavioral science. So I think what was most useful when I think about the use of the COM-B and TDF was the next stages. Now I've done the research to showing people what could happen. Now I've used the behavioral science and used the models. So what's really useful when I was presenting this to ICU staff was to look at what we can do next and look at what are the behavior change techniques that map to the identified barriers. So you have the theory and techniques tool, which is on the web, on the internet, which is a website, and that maps evidence-based behavior change techniques or mechanisms of change to barriers. And that was really useful here to kind of present, okay, now we have this barrier of we don't feel comfortable with talking about needing debriefing because of the people around you. You perceive that not failure as being resilient. What can we do to change that? And if you look at the website, look at the evidence, you can see clearly what we could do next. Do something around social opportunity, getting someone to role model that behavior, perhaps one of senior leadership, and that could combat that barrier. So it was really useful when demonstrating the evidence and credibility of behavioral science once we got to the findings, whereas when I was first kind of suggesting the use of behavioral science to my peers, they didn't really see the value of it. It wasn't until the end that they saw actually it's going to be really useful now. Now we're looking at how to address these barriers. Next. So the conclusion, so the summary of the research showed that it was a valued tool, whether people perhaps didn't use it as much as they could do due to a mix of barriers across 3 sections of the COM-B. And there's some key facilitators of actually trying to make the behavior habitual and getting senior staff to role model the behavior. So future directions would be perhaps looking at how we can co-design and implement interventions. So part of when I was actually sharing these results with ICU staff, it was starting that co-design, so presenting them the barriers, getting them to actually co-develop these interventions. So it's not on me as a behavioural scientist to kind of sit on a desk and kind of look at evidence. We actually need to do it with the people who are actually doing the behaviour. So it's not a kind of a desk silo-based project. It's actually collaborative. And then perhaps looking at more specific needs of ICU teams. So perhaps if someone who's a consultant, who's a doctor, has different barriers to someone who's a nurse, and going a little bit deeper into that. And that's me. So thank you for listening.
Yeah, good afternoon, everyone. Thank you so much for the invite, Georgina. So today, I want to kind of present to you a bit of a case study to bring to life some applications of behavioural science, specifically as how the room can sort of apply behavioural insights to qualitative research, and also take more of a systems approach to applying behavioural science as well. So just before we jump in, wanted to kind of briefly introduce the Behavioural Insights team. Bev has also kindly sort of briefly introduced us as well. We were founded within 2010 within the Cabinet Office with the mission to very much understand how we can improve policy outcomes through having a better, deeper understanding of how we actually behave, rather than trying to kind of make assumptions around how people behave. Since then, we've spun out of Cabinet Office. We still work closely with a number of different government departments, but we have now become sort of a global social research agency and consultancy, and with three kind of primary aims. And it's really about kind of trying to understand how people behave and why they do that. It's then applying those insights to kind of real life, to policy making, to the services and products that we consume as citizens, and then it's really evaluating what works. So we've got a big emphasis on the robust evaluation and methodology aspect as well. So in terms of today's talk, want to kind of show to you how really we can sort of start to answer these couple of questions. So firstly, how can social researchers use behavioural science to firstly identify blockers or barriers, as we often refer to them as behavioural scientists, to the behaviours we want to influence and change? And then secondly, how can we then use those insights to develop really kind of rigorous solutions to address those barriers and hopefully increase the desired behaviour and make that change? And through kind of showing you a case study, I hope to be able to provide a few tips on how to apply behavioural science to specifically topic guide design, so interviews as a qualitative research method, but also show to you how we applied solution systems mapping to a project as well. Because although behavioural science is often known for kind of its application through nudging, there are lots of other ways to apply behavioural science that hopefully try to kind of share some of that with you today. So firstly, just want to kind of introduce the project that I'll be kind of referring to throughout. So we were commissioned last year by ADEPT, which is the Association of Directors for Economy, Environment, Planning and Transport, long title. And we were tasked with trying to understand how we can get local authorities across the UK to decarbonise their highways infrastructure. So it doesn't sound the most sexiest research question. Often when we're thinking about reducing carbon emissions in the transport sector, we're focusing how we can reduce tailpipe emissions. But actually there's so much carbon associated with what we cover our roads in, what we cover the walkways in, how we light roads as well. And there's lots of opportunities there for local authorities to reduce the emissions associated with that. However, there was lots of blockers to doing that, and this piece of research really wanted to firstly understand what is hindering local authorities from doing this, and then how can we develop sort of behaviourally informed solutions to help address those barriers and really help encourage them, make it easier for them to take up sort of lower emissions materials and practices. So this particular project had three key stages, nothing too kind of revolutionary here. Our first stage was a familiarisation stage. So we actually came into this project as relative outsiders to the transport infrastructure space. It was our first kind of project in this space, so we really wanted to spend a little bit of time just getting up to speed. There's a programme going on at the moment where across the UK, 7 different local authorities are involved with testing different ways to reduce their emissions through their kind of infrastructure maintenance, etc., building new roads. So we used those as a bit of a test case and spoke with them, had a few Q&A sessions, etc. Then the second phase, the main kind of primary research for this particular project, was interviews with stakeholders, so representatives from each of those different local authorities that were involved in this programme, to understand what's been working well, what's difficult, and then we also did some solution co-design with them as well, and that was part of activity 3. So we did some solution interviews, and we also had some like a sort of workshops with various different experts and stakeholders, including Bev came along, to just help kind of iterate and really understand the potential feasibility and impact of those solutions. So some tips then for applying behavioural science to interview topic guides. Now I would say that these are kind of just an initial list, and I suspect as sort of social researchers in the room, you're probably doing most of these already, but quite nice to see how they maybe connect back and are underpinned by some of the lessons from behavioural science. So firstly, as part of our kind of interviewing, really start with defining the target behaviour. So I guess if we're wanting to kind of understand and explore what is helping enable or prevent a behaviour from taking place, we need to be really quite specific about what behaviour we're referring to. So in the context of this project, decarbonising local highways infrastructure isn't a behaviour, that's sort of like an objective, right? And it's made up of potentially so many different behaviours, through from kind of how we or how authorities may specify their invitations to tender through procurement, all the way through to capacity building, upskilling the guys and girls that are on the roads, actually paving them, etc. So we need to be really clear about what we're referring to, or the interviews themselves can be quite a nice opportunity to explore the behaviours within sort of a context and unearth some of that with the interviewee. Secondly, we've referred to COM-B&Es quite a few times already today. It's using these established frameworks to help inform our questioning and the prompts we use as well, just so we're structuring our insights around sort of the categories and the areas, the evidence where we know there's a lot of work already on what works to sort of shape behaviour in certain contexts. Third tip is around exploring behavioural biases indirectly through scenarios or vignettes. So we know that with social research, when we're directly asking people what they do, they may sort of skew what they say to be kind of socially desirable, or they may struggle with recalling it. Lots of biases can come at play. So we can use sort of tools such as scenarios and vignettes to almost create that third person scenario and get people to project, kind of reduce that propensity to skew responses, or provide them with kind of prompts to help them recall, which nicely sort of links through into the next tip around bringing in prompts, visuals, mock-ups, wireframes, etc., to help kind of aid that recall and create that conversation. And then fifth sort of tip around running little choice experiments on mock decisions to help kind of trigger real-time decision processes. So it's not something we did in this piece of research, but a way we could have done that is through procurement was a particular sort of area of focus. So it may have been that we could have mocked up a little bit of the procurement journey and asked our interviewees just to do a bit of a think aloud task on what are the sort of things that they're thinking about, what are their priorities, what's making it tricky to maybe prioritise material options or processes, practices, etc., that reduce carbon. And then another part of this project was to really take a system-wide approach. So at BIT, we did a little bit of thought leadership a couple of years ago and developed the upstream-downstream model. Essentially, this is trying to really kind of illustrate how individuals are ultimately kind of shaped by their environment. So at the downstream, we have individuals who are in turn sort of shaped by their environments and all the intermediaries who may influence those environments. And then at this upper end, we have the regulators, government, etc., who through their role of setting kind of the policy and regulation filters down. This is just to kind of show to you how we mapped this model onto this particular project. So essentially we identified all the various different actors at different levels, and that just allowed us to kind of really sort of try to understand what are their interactions, what are people's roles, what levers do they have, and kind of consider how that may inform our solution development, which I'll come back to later. So just to give you a flavour of what we found then in this particular project, we identified 8 key barriers. There were many more barriers, but I just want to give you a quick flavour of how that emerged through the research insights. So the first one was around, the theme was motivation to make green investment. And this is where we found authorities have kind of financial pressures to prioritise immediate financial savings due to maybe how budgets are set, for example. And having to kind of evidence shorter to medium term returns. And then another associated barrier here is a lack of or misaligned incentives to decarbonise due to a number of different factors, all the way through from kind of senior leadership team through to, again, how the budget setting works, etc. The next theme was around staff capital. So here there's lots of different sort of skills and capabilities associated with actually understanding kind of green materials and practices, so carbon literacy, sustainability regulation, innovation practices, for example. So there was lots of potential opportunity there to upskill staff to help kind of so they could sort of act on bringing in the new materials and practices to their particular authority. Then the next one's round, which I've mentioned, procurement challenges. So this is prior to the new Procurement Act coming into effect, so caveat there, but carbon is generally at the time not a standard part of award criteria. It was all about kind of what's the most economically viable tender. Hopefully that's going to start to change now, but it just made it really difficult to actually procure suppliers that may have been the most kind of sort of green option, but may have not been the cheapest. Then lots of really interesting things around organisational culture. So within authorities, ultimately they're made up of individuals who are all acting on their own incentives, but there's lots of different sort of interesting kind of social interactions, networks, etc., that influence what people are doing. So 3 particular things came out around entrenched behaviours, reinforcing existing ways of working, staff who had been sort of maybe within the authority 20, 25, 30 years, just kind of repeating sort of what they knew, very familiar, felt very safe. That related to then sort of this propensity for sort of a risk-averse culture. So then that creates this kind of hesitation to really want to adopt new materials and practices, and that there's some discomfort there. And then the really important role of leadership support as well. Ultimately, if the senior leadership team of these authorities wasn't bought in, that would really kind of create a disincentive to want to motivate change, because they just couldn't get things approved or passed. And then finally, collaboration and knowledge sharing. So this massively varied across authorities. We saw examples where working practices were quite siloed, and there was limited kind of knowledge sharing between even teams within an authority, never mind across authorities. And this then just led to kind of limited knowledge sharing and best practice and lessons learned. So creating opportunities for that was seen as a good way to maybe encourage others to kind of adopt desired practices. Okay, so I won't go through all of our different solutions that we identified and developed, and don't worry too much about all the lines on the board. What I really just want to emphasise here is actually changing behaviour is incredibly complex, right? So actually shifting the dial can be really tricky, and what we learned through this project, but pretty much most of our work, is ultimately there's no kind of single solution, right? And this is why it's really important to look at sort of how we can create opportunities for system-wide change and coordination across multiple different actors. And here what you're seeing with the bulk of our key barriers addressed, there is typically sort of multiple, they're attached to kind of multiple solutions. I just want to kind of illustrate that point. Similarly, on the systems side of things, I just mentioned, but we then kind of looked at how the actors that I showed you earlier that we mapped on, how kind of the solutions then sort of fit with their different roles and responsibilities and the levers that they have available. And ultimately, what we're trying to show here is that in order to deliver that meaningful change, ultimately solutions need to be implemented at the downstream, midstream and upstream, and particularly at the upstream in this particular case. So how can you guys and other social researchers use this kind of systems perspective to inform solutions development or kind of recommendations? Just kind of a simple sort of 5 stages here for you to consider. Start by kind of mapping who are the important actors at each level of that system. So your downstream, the individual level, that midstream, those are kind of intermediary actors, and then the upstream sort of relevant department, government departments, etc. And then think about what sort of levers and types of actions they have. So what sort of powers they have. Are they able to kind of implement something sort of within their powers, or do they need to advocate and partner with others to be able to do that? Consider what you've learned about how these actors interact with each other through your kind of desk research or primary research, and then consider any sort of dependencies between those different actors as well. Then do the kind of mapping of solution ideas to their actors according to their available levers, and this can help then inform a bit of an impact feasibility assessment, but with a behavioural focus, because we're behavioural scientists. So thinking about asking yourself questions. Are the right incentives in place at the moment for that actor to go away and implement a solution? And what do we know about what works to address the identified barriers? And there's so many opportunities there with the incentives piece about thinking about how we can sort of shape and align incentives for organisations to act and collaborate with one another. I forgot about that a little bit. So just on point 2, this is a really nice resource, which some of you may be familiar with from the Policy Lab, but thinking about government as a system. Sorry, it's come up really blurry, but if you just Google Policy Lab and government as a system, it'll come up with this lovely table, which just gives a real nice flavour of all the different types of ways that government at the upstream level can sort of have a role in implementing solutions. So yeah, that's everything I wanted to cover. I hope that was interesting. Contact details on the board, and look forward to questions.
How are we feeling? Yeah, we got that. Okay, so my name is Max. I'm a senior research director at an organization called Medano. Medano is a communications agency that works with and partners with other networks within the wider Avenir group to deliver communication solutions for mainly kind of healthcare providers, etc. And today I'm going to be talking you through how we used AI to humanize for a kind of digital health campaign targeted at public health campaign focused on women's health, basically, in the iron deficient anemia space. And this is one of the 2 presentations that we gave at BHBIA annual conference a couple of weeks ago. One of them won an award, one of them didn't. Do you want to guess which one I'm presenting today? That's right, it's the one that didn't win an award. So I'm sorry you missed the other one. Okay, so the background to this is we were working with an advertising agency called Cherry, and they had a client who really wanted to do a public health campaign focused on iron deficient anemia. And they kept on seeing all these adverts popping up on their social media and in real life and other places where they felt that, really women's public health campaigns were kind of very pink washed. They felt very kind of happy and, isn't everything amazing and everything perfect? And they didn't really feel like they reflected the true experiences of women with different diseases. And what they wanted was a campaign that ultimately empowered women to make different choices about their health. And what we did was we looked at this from what I would call like a digital ethnographic perspective, which I think is quite different to a lot of the solutions that have been talked about today, in that we didn't do any primary market research. We didn't speak to anyone, we didn't do any focus groups, we didn't serve anyone, we didn't do any experiments. What we did was we looked at people's behavior online, what they said, what they did, that kind of stuff. The ask from the client was, how do we build a public-facing campaign for iron-deficient anemia in women, a space where the client hasn't previously been in? So this is their entry point into this market. It has to resonate, it has to be proper, and it has to land with a community that ultimately they've never spoken to before and they don't understand. So for us as researchers, the important thing was to deliver insights as to what motivated women to take action to join online conversations about iron-deficient anemia. Ultimately, this campaign was going to be delivered online. It was going to be, a series of adverts, partnerships with specific individuals, and really they wanted insights in order to inspire them as to what would work in that space. So we did in-depth social media landscape and topic analysis into the connected systems following to really understand, followed by patient KOL stakeholder analysis. Now, what we mean by KOL here is key opinion leaders. So really it's about understanding how patients show up online in order to inspire a campaign, and then also understanding the individuals who have credibility and trust in this space already so that they can partner with them and elevate their messaging. So why not just do some interviews? So we thought about it a lot, and then we thought, we haven't got the money or the time. As always, research, you're always making least worst decisions. You want to do everything, but often it comes down to what the money and time you've got to do the stuff. Also, we felt that because this is going to be a digital campaign, and you often find that in qualitative interviews, people are reflecting on their behavior, why not just look at them doing it in the first place? Why not just look at them actually talking online and actually engaging with conversations? So what we did was we built a massive query string where we looked at lots of the different ways in which people can talk about this condition, its symptoms, how people felt talking about it, the issues that were raised in relation to it, in order to identify relevant conversations, and then looked at the channels and topics where this was taking place to give insight into what the content should be of the campaign, where it should be placed. And really, there was a clear need to understand the patient experience deeply. This couldn't just be a surface level, this is what these people talk about, and this is where they are. We had to bring it to life for the client team and also the end client, because as an agency researcher, in my experience, you've got to be persuasive. You've got to persuade people to choose the right thing to do within your research and bring it to life for the client so that they feel empowered to make the right decision going forward in building the campaign. So how do we find the data? So we did it in a few markets. So it was the UK, Spain, Germany, and France. And we identified just over 6,000 social media posts in a range of different places. And that was just for 12 months, by the way. So that these conversations are happening a lot. My favorite place to find this stuff is Reddit, because it's completely anonymous. People feel very at home. It's just a really safe space for people to express themselves, but also to really understand how people feel and things like that. And also people talk at length. You can go on there, you can look at these different channels and just find people talking about themselves and their experiences for paragraphs and paragraphs and paragraphs. It's really deep, rich data. So prior to building the search queries, what we did was we looked at, as I say, like all of the different symptoms and things like that and built an initial search string. Then we would go back, look at the data that we found in there, look at the different topics, and then reflected on our initial search strings in order to really build out this kind of comprehensive picture of the conversation around this. And then we also use kind of patient framing language within that in order to really make sure that we are catching absolutely the relevant conversations in order for the analysis. There's lots of different ways you can analyze data to kind of to state the obvious. We at Medano will use primary market research techniques, such as, we'll do frequency counts. So how many times have people talked about this? That kind of thing. We'll also use qualitative analysis. So building out topic areas, building out topics based on like qualitative analysis grids, all that kind of stuff. But we're also got some now great tools available through AI, including, large language models, which allow very significant thematic analysis at a very large scale. Obviously, you have to be very careful with the data that you've got. You need to be making sure that you're working in a sandbox, i.e. you're not putting data into the LLM that it can take out, because you're ultimately often playing around with private data. And you have to check at every stage that the AI isn't hallucinating or coming up with random stuff. But these tools are incredible for what they can do to cut down your time in analysis. But I think what's really great about them, what needs to happen is we need to think intelligently about what we're prompting it to do. And one of the things that we often do is, instead of just saying, summarize this, what are they saying here, is we say things like, what is the belief that is being expressed here? Because often what you find is they will summarize down and look at it from like a robot perspective of, this is literally what they're saying. Whereas what we're trying to do often within behavioral insights and within insights to inspire campaigns is to understand, what are they trying to communicate? What is the belief that they're trying to get out of this? So providing some of these frames can be really instructive in terms of getting more out of these LLMs. Another thing that we did was we would combine different bits of analysis together. So you would have thematic analysis, where we would try to understand what it is that people would be communicating, and then emotional extraction. So what are they communicating and what emotion are they expressing when they're talking about these different topics? And combining those two things together is really critical in building a real sense of how humans talk about different subjects. What we can see is, and I don't know why we've taken out the emotions here. I think it's because it's supposed to be protected, but we'll let you in. I'll let you in on a secret anyway. So yeah, in this case, what we found was that frustrations in iron deficient anemia and management and treatment, and difficulties navigating healthcare systems were the top two biggest themes of what people were talking about. So really, when you're looking at at speech around this, the two biggest topics are around kind of post diagnosis care and challenges in just navigating that system. And when we spoke to the account team, they said that this definitely resonated. But what's really interesting about this is, across all of the different themes, you can see that one emotion was the consistent drumbeat around this, and that one emotion was frustration. So frustration was the key through line that we identified as being the most important thing for this campaign to address. And that was a really great moment for us, because we've used this emotion and topic combination stuff before, and people are always like, it's AI. Is that really true? Is that really the case? But this is the first time that frustration came out as a key topic across all of them. And in other areas where we've used this combination of models, we've found very different things. So it feels true, and when you drill into the actual what people are talking about, that frustration comes through really clearly in the verbatim comments. Another thing that we did was to really bring this to life for clients. We created videos through AI, and these were based on scripts that were based on the original verbatim comments. And obviously, we have to be incredibly careful about using private information that we've taken from the internet. We can't just download data and share it verbatim, because that makes the individual at the end identifiable. So what we did was we would run all of our quotes through the LLM and say, can you rewrite this and subtly change the wording so that it's completely unidentifiable? And that way we understand from our perspective what is being said, and we can do the linguistic analysis, but the client at the end doesn't see that, and the patient who is talking online is protected. Insight to impact, what happened? So through looking at all of these different topics, we informed the engagement and education strategy for HCPs, the content to talk about in the campaigns, the channels that they used, and the individuals that they can use for partnership. We had an all-day workshop yesterday. Well, I wasn't there, but there was an all-day workshop in London yesterday where this was debriefed to the client. And what was really great about it was there was a direct through line from this research to the creative concepts that are now being discussed and should be rolled out soon. And that's always amazing to see when the nugget of, oh wow, that's quite interesting, goes from being on your computer screen to actually being used. So yeah, it was really good fun. And I think that's it.
Well, whoever I'm going to pick on, basically. So do we have any questions from the audience for any of our speakers, either individually or as a panel?
Yes.
How do you know when to use, sorry for this question, how do you know when to use a nudge versus to use more of a kind of behaviour change model? Like,
Okay, so just for the video, I'm just going to repeat every question. I should have said that. So the question was, how do you know when to use a nudge rather than a behaviour change model, or more like systems approach? Yeah. Who would like to start? I mean, maybe Lauren, do you want to have a go with that?
Yeah, so I guess the headline would be thinking about, identifying the barriers to what behaviour you're trying to change. So I guess if it's something that you're looking to influence quite subtly, and sort of you are working with a client or have access to the environments in which individuals are going to be sort of undertaking that behaviour, that's when I guess something more sort of nudge based would be appropriate, versus when there's more systemic barriers at play. So thinking back to sort of the model I showed, the upstream downstream model, if you're identifying barriers that are coming through more, not just at kind of the individual and the midstream level, but also at the kind of upstream regulatory policy level, that's maybe when something more, as you described, systemic is needed. So that's kind of probably the headline from me. Would anyone like to add anything else?
Yeah, I think the initial nudge is sort of a great tool. It's very intuitive. It's very easy for people to kind of get their head round, and the dual process theory and heuristic biases. But the behaviour change wheel is so much more sophisticated, and then system thinking is more sophisticated again, I think, and issues aren't sort of just at the individual level, as Lauren sort of really expertly showed. There's all these kind of upstream factors that lead to it. I'm trying to remember there's a website which will tell you which kind of tool and framework to use in which situation. So I don't know, did you refer to it, Govindeep? The theory and techniques tool, that's right. And there's things like the theoretical domains framework, stage of change model, that kind of thing. And it will say, are you trying to change, say, a health behaviour, that kind of thing. And there's lots of different models which are more appropriate in different circumstances. But the behaviour change wheel's a great one because it integrates, I think, 19 different frameworks. And system thinking is another level of sophistication again.
Thank you. Any other questions from the audience? Yes.
Right, yeah. So a lot of the presentations were talking about sort of interviews as a method. Obviously, Max, you talked about ethnography. Are there any other social research methods that would lend themselves to behavioural science?
Yes, that's a great question. So, are there any other methods beyond the ones sort of discussed that would lend themselves to behavioural science? Max, you want to start?
Yep. I think you can basically use pretty much any different research method. And really, in my mind, and I don't know if anybody would agree with me, behavioral science is very much a lens through which you think about research rather than necessarily, and a set of tools to think about it rather than necessarily a method specific thing. I think so. For example, I'll give a quant example because I think that's the one that hasn't really been covered. There was a rare disease which affected 1 in a million kids, and we needed to understand the pathway through a set of specialisms. I think there was about 14 different specialisms that these kids were being bounced around. So we designed like a kind of case study, a set of case studies, and did a choice experiment where you were able to simulate that bouncing, and from that we're able to derive, okay, so in X market it takes Y number of switches to get to the consultant immunologist where they need to go. And so, there's basically, you can use it in any different space. I think the thing about behavioral insights that I quite like is it forces you to really think about the reality and to reflect that in your research in a way that other lenses kind of forget, I guess.
Excellent. Yeah.
Really quickly add something. Yeah, definitely echo everything Max said. Maybe just to quickly add, I guess with a behavioural approach, you're ultimately trying to move away from that plain behaviour to the more observed behaviour. So there's ways of doing that within sort of each social research method, or through, as social researchers, a mixed methods approach, through kind of triangulating your different insights to try get to where there may be issues with claim behaviour coming through, and actually comparing that to your observed behaviour insights. But yeah, definitely lots of applications. It's not here trying to kind of step in for any particular method. It's very much kind of complementary.
Can I just add a sort of additional question onto that is, what happens if you are already partway through a research project and you realise that a behavioural science lens would be really, really useful? Is that terrible? Is that something that you would could say your research materials haven't been designed with behavioural science in mind, and then you start to see themes emerging that would be benefit from that lens? What is kind of best practice at that point? Do you have to start again, or are there ways to shoehorn, or is that completely methodologically unacceptable? Thoughts?
So I kind of basically did that intentionally in my research. So kind of makes sense to me to cover that one. So yeah, I think it's fine to perhaps do it in that way in terms of you gather your data, then apply the behavioral science afterwards. Perhaps similar to what you touched on, Max, was you gathered data that already existed. You didn't kind of collect that data through any method where you created the design to collect it. It was just there, and you apply the behavioral science afterwards. So I don't think it's an issue to apply the behavioral science models afterwards. So yeah, not a problem.
I'm quite pragmatic, and an insight is an insight. If you think, no, actually, well, I could apply this framework to this. It's not perfect, but no research ever is. Then the best is the enemy of the good, and an insight's an insight.
Any other questions from the audience? Yeah, Sam.
Across the board, do you guys have any kind of practical tips for when you're kind of first designing a research project using behavioural science? Any kind of like tips and tricks in terms of doing a research project that uses behavioural science versus one that doesn't?
So practical advice on the first steps, I suppose, to starting. Lauren, do you want to?
Yeah, so I guess a real sort of quick way of thinking about how to apply it from the get-go is thinking about that target behaviour that I mentioned in my presentation. So that may seem quite kind of straightforward and simple, but actually it's quite easy to get mixed up between behaviours, attitudes and beliefs, right? And we need to be quite specific on what behaviours we're trying to influence and change, or at least going with some sort of assumptions or ideas for which the research can then go on to perform. Definitely recommend looking at BIT. We quite often use our what we refer to as TESTS methodology, and that's just an acronym, and the T at the start stands for target behaviour. So with quite a lot of our work, that very initial stage is defining the target behaviour for which then the subsequent steps can sort of follow, explore how that behaviour is sort of carried out within its environment in terms of what barriers and enablers help or prevent that behaviour from happening, then thinking about sort of solution design, then going on to the testing, and then if you find something promising, the scaling. So yeah, we've got sort of a short report on that test methods, if that's helpful to kind of look at and think about how you could apply that to your own research.
Jump onto that. So I think touching on what you said really is building on, I think quite often where perhaps people struggle or make a mistake is not identifying a behavior or a target behavior, maybe getting it confused with something else. I think what's a quite simple way to think about it is try and identify what's the behavior, what's the influence, and what's the outcome you're looking for. And then perhaps work backwards, because quite often what gets mixed up is we identify an outcome as the behavior, and that's really not what it is. And I think like a good example that I've seen through some training is think about the example of being healthy. That's a clear outcome, but there's many different ways we can become healthy. So it could be exercise, it could be diet. If you think about the behavior of perhaps going for a walk, there's so many influences on that actual behavior. And then think about behavioral science, what's really helpful is trying to make the behavior as specific as possible. And for general support, I think what's really useful is the documents that have been put together by Public Health Wales. They have quite a lot of really useful documentations that are kind of beginner friendly of how to use behavioural science, from actually creating a whole intervention or just doing the data gathering and collection piece. So I'd recommend having a look at those.
In DFT, we have the model that I basically talked through, like, so how do people behave? Why do they behave in that way? What would make them change, and how can we test it? And we've got some different methodologies that we tend to use under each one. So if it's how people behave, we might do a systematic review or some user journey mapping, or a workshop with the key people. If it's about why they behave that way, we would look at sort of personas analysis. We'd look at mapping, barriers and facilitators, that kind of thing. Again, REAs. What would change their behaviour? We'd kind of look at behavioural theory, perhaps, and we test often using a randomised controlled trial, ideally, if we're talking about large scale behaviour change.
Any more questions? I think there's another one at the back. Yeah, right there.
Specifically, the question is about maybe I misunderstood this, but in your presentation, you talked about your section of research and intervention. It seemed very intuitive in the process, whereas a lot of the other presentations seem to be not based. And I was wondering if you agree if that was what you made, and actually pros and cons to the approaches.
Yeah.
So just for the recording, just the questions around the sort of the analysis and jump to the intervention in Max's presentation about that being more intuitive versus framework based. So take it away.
Yeah, I think what's interesting about working in a communications environment is that often people don't care about the processes that you take to get to the end result. They just want the end result. So we have, as an insights person in a communications agency, we've kind of learned to show, don't tell about behavioral frameworks. It's something that we use at different stages of, designing a research project, analyzing the data, but through experience of painfully describing why somebody is a capability and not not an opportunity, or whatever it is, to a client who just frankly didn't care. We've learnt to kind of just dial down on the talking about behavioral insight, and instead dial up on the kind of the showing how the telling of a story of how it makes a difference to the work that we do, I guess.
Okay, good. Thank you. Any other questions? Yes.
Are there any major ethical considerations that people make when they're applying behavioural science to social research?
It's a brilliant question. Any major ethical considerations in behavioural science? And are these different, I suppose, to other methodologies or frameworks? Anyone want to have a think about that?
I guess from an academic not from an academic perspective, that seems to belittle it, but like there is that debate as to whether you're undermining the agency of individuals in doing a thing. But I think the reality is that you're always influencing people or seeking to influence people, and therefore you may as well try to do it effectively rather than ineffectively. But as to ethical considerations, there should always be ethical considerations in any research project, and that should be a key factor.
Yeah, I guess I'm kind of thinking it depends on kind of where you're applying it. Perhaps if you're working in a corporate industry and you're using behavioral science to design user interface, perhaps there's some ethical considerations of perhaps simple nudges like default tick boxing stuff around perhaps information they need to read, and if you default that, they more likely to skip past it. There's some ethical considerations there. And if you look at perhaps public health, if we're making behavioral science nudges there, we need to make sure that if we're trying to nudge people in one direction, we've got some evidence behind why we're nudging in that direction, and the information that we're using or we're collecting to develop that intervention as well.
Just a quick recommendation, I'd suggest looking at Nudge for Good, which is a sort of mnemonic developed by Dilip Soman, I believe. So that gives you several different principles to think, am I applying behavioural science, specifically sort of nudge-based interventions for the right reasons?
I mean, the social research is sort of shot through with kind of ethical considerations, and all of those do apply, data protection and not causing harm, that kind of thing. But as Matt said, and there were, when I think the nudge unit was established, there was sort of just debate about, is it unethical to try and push people in one direction or another? But you can't not. If the sweet is at the till, to encourage kids, test of power, for the parents to buy, well, why not put fruit there? You're going to influence people one way or the other. You might at least try and do it in their own best interest.
Fantastic. Any more questions from the audience? Yes.
Thanks for the really interesting range of case studies. I wondered whether I do quite a lot of, I'm an evaluator, and I do quite a lot of work on people's sort of changing practice, and often get myself in a bit of a kind of mire about what's a sort of personal behaviour change versus what's a kind of practice change that influenced by the factors. And I just wondered, do those, you talked a little bit about some of the ways that comes through in different models, but are there different ways in which behavioural science kind of helps underpin that, and how you categorise those different influences?
Yeah, absolutely. So how can behavioural science help categorise the different levels of behaviour change, from personal to sort of culture, all the way through to systems? And yeah, are there any ways you can sort of help start thinking about that in your analysis? Anyone, Lauren?
I think what would particularly benefit in terms of sort of change management practice is conducting like a systems map, where you're essentially trying to set out who are all the different sort of primary actors, and what kind of relationship do they have, and what is the objective of what you're trying to change? Are they able to kind of change? Are you able to kind of deliver that change through sort of the individual? Do they have the powers to do that, or is there some sort of dependency with other actors kind of in that system? We have a really nice example of this, of some work we did in a hospital. I'm I'm not kind of close to the details, but if you just Google sort of systems mapping behavioural insights team, it should come up, and that will give you quite a nice relevant example, I think, to your work.
Systems mapping is brilliant. Something else you might want to look at is the organiser tool on gov.uk, and it was developed as a, I suppose, companion to Mindspace. It didn't take off to the same extent, but it was about how to influence organisations rather than individuals, because organisations aren't as kind of responsive, or there's different incentives for organisations. They tend to react in a sort of less emotion-driven way, and that is worth looking at. Although organisations are made up of individuals, the incentives are different, and the levers that you can use are different.
Fantastic. Any more questions from the audience? Go in. Yes, at the back.
Hi, sorry, a bit more of a sort of holistic question, but in terms of influencing people's behaviour, how, obviously we all have our own biases of what we think the best behaviour that people should do is. So I'm not talking maybe sweets versus fruit in the long term, obviously the more healthy option is better, but with decisions that are a bit more subjective, how does it work ethically to push people in one direction if it isn't an objective best behaviour?
Good question. So yeah, how do we work ethically on sort of nudging people or influencing people to do behaviours that are maybe a bit grey area-y? Yeah, sorry.
I guess in those instances, it's just really important to kind of make the active choice quite salient. So maybe rather than going down the route of more sort of subtle influences, for example, defaulting a decision one way. So thinking about maybe a classic example of purchasing a flight, and there's all these kind of defaulted options, right, to kind of upgrade seat or add extra luggage. If that's not necessarily in the user's best interest, it would be a case of trying to sort of, rather than having that as a default, just switch it to a more kind of salient question. So that's kind of quite a nice example of just thinking about different types of intervention. And if there is that uncertainty or that concern around ethics, it's all about, I guess the baseline is retaining that choice and enabling someone to make the right choice for them as well.
I think it's important to think deeply about the research that you're doing and the consequences of it. And I also think I think from a agency perspective, there's often pressure to do the research you're paid for, right? Because that's how you get paid. But I think luckily I've managed to work at agencies and in organizations where I think we've always been able to turn down research projects, basically, because sometimes you are asked by people to do research that will nudge people down the wrong path. And I think at some point you've just got to kind of not do the research and say, sorry, this isn't one for us. And somebody else might do it, but there's nothing really you can do about that. So.
Yeah, and I guess to add to that from kind of my own experience, there's also, every research project is not the only research project on that, and it's not the only behaviour change and a behavioural nudge and behavioural influence that exists. So they're all competing against each other, aren't they, as well? So I guess it's around making the ethical choice to do the one that organisationally is deemed the best, and being transparent about how you got there and decided what it is. But obviously, as we both work in an agency, it's more about choosing the projects that align with what you think is sort of with the values of the agency or personal values as a researcher.
I'd just add to that, you can also use behavioural science or knowledge of behavioural science to uncover when people are nudging people for the wrong reasons. I know BIT's done quite a lot of work on gambling and gambling websites, and how they can use these techniques for sort of suboptimal purposes. And I believe the Competition and Markets Authority's got an active behavioural science team that looks at how people are manipulated into making poor financial decisions.
Fantastic. Any final questions before we finish? That's a really good question. So yeah, thank you everybody. That has been very, very interesting. So much to think about. Thank you so much again to all of our speakers. So another round of applause for all our speakers.